Hi, welcome to this video. In this X-ray of the knee lateral view, uh, I'll give you 15 seconds to identify what is A, B, C, D, and E. All right, I think I've given enough time. With that, we will identify all these five structures. A is definitely the patella. Patella is a sesamoid bone which forms in the tendon of the muscle that you're seeing here. This is a soft tissue shadow of a bulky muscle in the anterior part of the thigh, and that is the quads or the quadriceps. It is in the tendon of the quadriceps muscle that patella is formed. Patella is an example of a sesamoid bone, and that has a lot of implications, especially in the treatment of patella fractures. The next, we are going to the structure C. C is the patellar ligament. You can see a fade soft tissue shadow over here. That is the patellar ligament. And you can identify, you can understand that the quadriceps, the patella, and the patellar ligament are in continuity, and which leads us into the structure that is D. D is the point where the patellar ligament gets attached onto the tibia, and D is the tibial tuberosity. Patella is basically suspended by the quadriceps pulling upwards and the patellar ligament getting tensed. So the patella thus articulates with the trochlea surface of the femur, creating a patellofemoral articulation. This is the patellofemoral articular space. It is important to note that patella is articulating only with the femur and not with the tibia. And which brings us to the next structure, that is the structure labeled as E. Let me just clear all these four structures which you have already mentioned, which is in continuity, to understand what is E. Okay, so E is, you can see a little more darker region. You can see this border, which is a border between a relatively radio opaque region and a relatively radio lucent region. So this region that is appearing a little more dark in a lateral view X-ray is the infrapatellar. This is below the patella. So this is infrapatellar fat pad. Infrapatellar fat pad, and also called as the Hoffa's fat pad. Please note that the Hoffa's fat pad or the infrapatellar fat pad is behind the patellar ligament, which we mentioned as the structure C. So it is behind patellar ligament, in front of the upper part of the tibia, and also the structures that are present here, that is the meniscus. And this fat is in the knee capsule, but outside the synovium. So it is intracapsular but extra synovial. Let's just confirm this in diagram, in which you can see that this is the quadriceps and this is the patella. This is the patellar ligament, and this small bump that you see in the anterior part of the tibia is the tibial tuberosity. And behind the patellar ligament, you can see this structure. This is the infrapatellar fat pad, and you can see that it is sandwiched between the patellar ligament and the upper part of the tibia, and also in front of the menisci, and it is extra synovial. This red color that you see here is the synovial membrane. So it is extra synovial but intracapsular. This is the Hoffa's fat pad or the infrapatellar fat pad. So let us quickly look at these structures in an anterior view of the knee also, where you can see that this is the femur, and this is the anterior part of the femur, where you have this large muscle bulk. This is the quadriceps. So this is the quadriceps lower tendon, in which you can see the patella. This is the superior pole of the patella, and this is the inferior pole of the patella. Extending from the inferior pole of the patella, you have the patellar ligament, and the patellar ligament is ending at this bump on the tibia, and that is the tibial tuberosity. And you can see that these four structures, the quadriceps tendon, the patella, the patellar ligament, and the tibial tuberosity, is in continuity. And behind the patellar ligament and in front of the tibia, you have the infrapatellar fat pad, or the Hoffa's fat pad. And in this picture, you can see that in an extended position of the knee. This is the extended position of the knee. In that position, the infrapatellar fat pad is slightly bulging on both sides of the patellar ligament. You can feel this bulge below the lower pole of the patella. Okay, that is the Hoffa's fat pad, and these are the anterior structures that you see in the knee, almost in the midline of the knee. Thank you.